Hello everyone, my name is Marcelon Jr. I'm from Brazil and I'm going to present my research titled Approach and Interaction for Pharmaceutical Care Issues in Drugstores Clinical Environments. This study was conducted at the Federal University of Paraíba, Brazil, and I had the supervision of Professor Dr. Elaine Espíndola. So, first of all, let's contextualize this study. This study was developed based on the professional discourse studies and also in the pharmaceutical care. And we selected the professional discourse studies because there is an increasing research in this area, especially because of its interdisciplinarity. And as linguistic resources, we have selected the Systemic Functional Linguistics, the theory developed by HALLIDAY Matthiessen. And from our readings, we have seen that there are a lot of studies conducted gathering professional discourse studies and systemic functional linguistics. And these studies are especially related to the medicine area, law, journalism, and social work. However, as we couldn't find a lot of researches conducted in the pharmaceutical area, we selected, especially when we read texts in Portuguese, we selected the pharmacy area to develop this study. So we focused on the pharmacy as the knowledge area and the pharmacist as a professional and the pharmaceutical care as a professional practice, all of them related to the pharmacy studies. And it's possible to define pharmaceutical care as a professional practice in which the patient is the main beneficiary of the pharmacist's actions. And from this discussion, it is possible to ask why have we conducted this research? So this is a new research, especially because it takes the pharmaceutical area as a tool of research, and also because we've been developing new linguistic studies especially when we focus on the systemic functional linguistics. And according to Keller, she says in one of her articles that there are specific linguistic studies in the pharmaceutical area. So from this data, we learned that we need more to conduct more studies in this area, especially when we gather linguistics and pharmaceutical care. And for this study, we have a mix between the pharmaceutical care and the systemic functional linguistics as theories related to the professional discourse, and all of them together can promote the well-being and health of the general population. So we want to understand how the language may promote all of these issues for the population. But inside a lot of drugstores, especially here in Brazil, it is possible to find clinics, and inside these clinics there is the pharmacist, and the pharmacist conducts a lot of pharmaceutical care services. And it's possible to mention some of them that it is possible to be found inside the drugstores here in Brazil, such as blood pressure checking, capillary blood glucose measurement, and more recently, because of the pandemic that we've been experiencing, there are a lot of COVID tests done inside the pharmacies. And what's the main purpose of this research? Is to observe the communicated discursive interaction between the participants. Who are the participants? The participants are the pharmacists and customers, especially for this type of research. And we want to analyze this interaction in the approach between the participants in order to perform clinical care. But what do we investigate on this research? First of all, the context in the drugstore, especially when we talk about the conduction of pharmaceutical services, the ones that I mentioned before. And what we have noticed is that the language is used in the approach between the participants on two types of interactive demands. And the two types of interactive demands that we have discussed in this research is spontaneous demand and the non-spontaneous demand. Each one of them we can find the customer and the pharmacist interacting in the speech. So first of all, the spontaneous demand happens when the customers naturally seek for the pharmaceutical service based on the symptoms and needs they have. So it means that the customer goes to the pharmacy and the customer asks for the service that is undertaken inside the clinic. And in the non-spontaneous demand, the customers are approached by the pharmacist during their purchase and invited to be part of the pharmaceutical care actions. So when the attendant here in Brazil, it's very common the attendants dispense some medicines and the pharmacist observes what is being dispensed, and according to the medicine dispensed, the pharmacist may approach the customer and invite the customer to undertake the service inside the clinic. And this may be good for the customer, especially because the pharmacist may check if there is one type of problem with the customer's health. But in this research, how was the data collected? So first of all, we recorded the speech between the participants. The participants here focused on the customer and the pharmacist. However, it is possible to find three types of participants: the customer, the pharmacist, and patient. But the customer becomes a patient only when the customer accepts to get the service, especially in the non-spontaneous demand. And when the customer goes to the pharmacy in the spontaneous demand, the customer may be customer and patient at the same time. And after recording the speech between the participants, there was a later transcription to observe the clauses in the interactive interversions in the oral text produced during the conversations. But what's the main goal of this study? This study wants to learn and to understand which semantic or discursive choices are used by the customer to obtain the service in the spontaneous demands, and which semantic and discursive choices are used by the pharmacist to convince the customer to undertake the service. And this is done when there is the non-spontaneous demands. So what have we found from this study? First of all, we are going to talk a little bit about the spontaneous demand, and it's important to mention that in the spontaneous demand, when there is the speech between the participants, in the spontaneous demand, the customer starts the speech, and there is the interaction later with the pharmacist responding to what the customer asks for. And here we have some examples of clauses that they were recorded, and here we're gonna have a little analysis from this data. So in black, it is possible to find the sentences, the clauses written in Brazilian Portuguese, and in pink the sentences translated from the Brazilian Portuguese into English. So first of all, there are the clauses: tá medindo a pressão? That is translated: are you measuring the blood pressure? Faz glicemia? Do you take blood glucose measurements? O farmacêutico está aí? Is the pharmacist there? So all of these clauses were spoken by the customers, and they used these interrogative clauses in order to certify if the service was being provided by the drugstore. So when the customer asks this type of clauses, the answer may be yes or no, and this shows that there is polarity in this type of clauses. And also these clauses are spoken with the exchange of goods and services in the interaction between the customer and the pharmacist. So besides the interrogative clauses, the customers also use declarative clauses to ask for their service. First of all, they checked if the service was provided, and then it is possible for the customers use declarative clauses to ask for the service. So again, in black, the sentences, the clauses in Brazilian Portuguese, and in pink, these clauses in English. Vim medir minha pressão. I've come here to measure my blood pressure. Gostaria de fazer o check-up. I would like to check up. So again, there is an exchange of goods and services in the interaction. However, the customers use declarative clauses to ask for the service, and it is followed by command to obtain the service. For example, I've come here to measure my blood pressure. It means the customer came to the pharmacy and he wants to have his blood pressure measured. So it is a command. It's like, I came here to measure my blood pressure, please do it. And the same happens to I would like to check up. So it's a way of asking to obtain the service. So now analyze the non-spontaneous demand, and this demand is usually started by the pharmacist, and the pharmacist approaches the customers when they are shopping inside the drugstore. And here we have two dialogues between the pharmacist in red and the customer in black. The one on the right is written in Brazilian Portuguese, and the one on the left is the translation of this dialogue. So usually in the non-spontaneous demand, who starts the conversation is the pharmacist. As you can see here in the dialogue, the pharmacist says, "Good morning, ma'am." So, and the pharmacist always uses a lot of WH questions in order to get more information from the customer. And this information that he gets from the customer makes the flow of the dialogue. So it is possible to find when was the last time you measured your blood pressure. Here we find a question word when. How often do you check up? So the pharmacist asks for information, and from this information the pharmacist may convince or not the customer to undertake the service. However, it is possible also to find declarative sentences as it is good to check up. So the pharmacist says it's always good to check up, and the customer understands that it's good to check up. So here we have an exchange of information between the interaction with the participants. So here we see that the pharmacist asks for a lot of information to convince the client, the customer, to undertake the service. So as I have just explained, so the presence of WH elements, it's we can find a lot of WH elements in the non-spontaneous demand, and in order to exchange information. And these interrogative clauses ask for some additional information. For example, how is your health going, ma'am? When was the last time you measured your blood pressure? How often do you check up? Why haven't you undertaken your blood pressure very often? So the pharmacist asks for this extra information, and from this extra information the pharmacist can use the language to convince the customer to undertake the the service inside the clinic. So from these data that we analyzed, it's possible to conclude that there is an interaction and regularity in the discourse, especially on the non-demand and the non-spontaneous demands, because the language is used as a social practice, and there is the interaction between the participants, and this makes the speech. And this study is a previous study, but we have found a lot of data, and we analyzed all of this data for this study. And this study is based on the SFL, especially in the use of the interpersonal meta function. And in the pharmaceutical care using the SFL studies, it is possible to find in the two types of demands exchange of goods and services and information. And we may find that the interaction between the participants on this discourse seeks to promote health in the view of the language choices, because of course when there's the interaction, each participant selects a lot of choices from the system to use them during the discursive and interactive exchange. And this study also may investigate other perspectives within the SFL. And this is just the beginning of this study. We have much more to study about, and we hope in the future to get more studies and to help the SFL area, especially in the pharmaceutical care, to conduct more researches in the linguistics area. So that's all. Thanks for your attention, and see you next time. Goodbye.